It's the middle of the coronavirus pandemic, and everything feels really out of control right now. We don't have control over what's going to happen. We don't know who has it and who doesn't. We're just trying to figure out how to test people, and it's a time of a lot of uncertainty. It's kind of hard to know what to do.
So, in the midst of times of uncertainty, I think we all want to figure out, is there something that I can actually do? And the answer is yes. So, it's pretty incredible the way God lines things up. We felt a deep sense of urgency to start Healing Grove Health Center immediately. And that's made life hard for us because it means that we're leaving a job without a paycheck, without a future. We don't have enough funding. We're not, we have all of these struggles. And we've kind of been like, God, why are we on such a fast timeline? Why can't we slow down a little bit and kind of
do things logically?
Yeah, by the world standards, let's maybe get funding and a paycheck before we quit our job. And I think today we realize why. So why don't you share what happened for you today?
So I had just kind of picked March 12th out of the hat of just I need to stop working because I have so much work to do for Healing Grove. And then, so today was my last day of work at a job that actually pays me. So I'm going to be doing Healing Grove full time now. And I guess it comes at a really interesting time with respect to the coronavirus. So I am available to start working on that as well. I also am acutely aware of a lot of people who are uninsured and who are sick at home with fever and cough. And, we, up until this very minute, haven't found a way to test them because the tests are expensive. We don't have the media. There's the viral media that they transport in. We need a agency that will receive the bill from the test site. There's just all these logistics that have been hard to figure out. But between a lot of generous people and even the Board of Supervisors for the county, we've been in conversations with a lot of people, and it looks like it's actually going to happen, which is tremendous.
So today we were on the phone with the County Board of Supervisors working out how to get testing paid for low-income and uninsured people. So here's what we need from you. We want to get Healing Grove off the ground right now. We want to meet this need right now. There are uninsured people in our community that probably have coronavirus, and it's going to be tough on our community because in wealthier communities, people have rooms that they can isolate sick people in. Well, we don't have that. In our community, there's 5-10 people living in a one-bedroom apartment. So when this goes around, it's going to go around quick, and it's really going to hurt our community. On top of that, there's going to be major economic impacts on our working class community because they're not going to be able to work from home. You can't do construction from home. They're not going to be able to take paid time off. And we're already seeing that start to happen. So here's what we need. We want to start a sponsorship program right now for Healing Grove. Here's the way it works. We can provide really high quality, holistic Christian health care for $70 a month, which when you think about it really isn't that much. $70 a month to take care of one person. And we want to ask Christians throughout the valley to step up and be a part of that sponsorship program. If you want to jump in, now's the time. You can go to healinggrove.org/donate. And there you can find two ways to give. One, you can give to our sponsorship program. And two, you can give to our building campaign. So we're still working on building Healing Grove Health Center. We need to raise about $300,000 more for that. We're still working on getting our determination letter from the IRS saying that we are a nonprofit. We're in the process of applying for that. So if you want to make a donation to our building campaign, you can actually make the check out to the River Church. They're acting as our fiscal agent until we get our 501c3 set up. But this is a great chance for you to jump in. We are going to be caring for uninsured people starting tomorrow.
Yeah.
Literally starting tomorrow.
I'm going to go do home visits, and I'm going to get the word out to everybody who is in the community who can talk to each other. This word spreads very quickly by word of mouth in that community, and so we'll just say, hey, if you're uninsured, if you have a fever and a cough, here's the number to call. We'll come to your house and we can swab you right there. As long as I can get enough test kits, we can send these off to Quest and get everybody treated, figure out who needs to quarantine, who needs to just not worry about it because they have rhinovirus or something else.
So this morning we had a meeting of our parent leadership in the Washington community. About 30 women were there this morning, and we had a tough conversation about how we're going to deal with this as a community. And we started handing out Dr. Angie's phone number, and we told people, if you're sick, call us, and we're going to figure out a way to test you. And again, I made that promise on faith that we'll find a way. I said, if you're sick, we're going to take care of you. Right now, we don't have the money. We don't have the resources to do it, but we're just hoping that we can find a way. So if you want to step up and meet that challenge, now's your chance. We'd love to see 100 or 200 or 300 sponsorships so that we can really get out and begin to care for the most vulnerable and the most needy in our community.
Yeah.